All right, we're on.
Alrighty.
Get in here, James.
Haha. Alright.
Assalamu alaikum wa rahmatullah. I'm Gareth Bryant,
I'm James.
and this is Sharia's Anatomy.
Okay. So we're here to talk about bioethics and biomedical ethics from an Islamic perspective. That involves medical questions, healthcare questions, anything that require ethical decisions. You know, doctors don't always have the best answers, especially from a secular viewpoint. It's how they do it in school. So,
Or no answers.
no answers. That's true. But thank God we have Islam to help guide us. So help us make some of these difficult choices. So this is our first episode. Let's just introduce ourselves.
So I'm Chaplain Gareth Bryant. I've been a chaplain doing healthcare chaplaincy and also prison chaplaincy since 2014. I've recently submitted research to Michigan State University's Department of Psychiatry pertaining to the compare and contrast of attajneen, jinn influence, jinn possession versus mental illness, which was graciously accepted by Michigan State University under peer review of their psychiatry department. And Michigan State, for those of you who don't know, Michigan State University is among the top 10 universities on the planet which specialize in psychiatry. So not only did they accept my research, they invited me to speak this year at the annual Muslim mental health conference, which is scheduled to be at Clare College at Cambridge University. So that's
Pretty good.
Yeah.
All right. Yeah. So I'm I'm James. I'm from Long Island. I'm a board certified doctor in family medicine. I did my residency at Case Western. I did my master's in public health at NYU. And I have did research on health on immigrant communities in Queens, and I studied bioethics, and I have about 19 years of various kinds of healthcare experience. So yeah, you and I have a lot of interesting stuff in common because we both work in the healthcare field.
Yeah.
And it's lots of different stuff, and lots of patients have questions that, first just want to put a disclaimer out that, neither of us are scholars, right?
Right.
None of us has an ijaza, and don't take anything we say as a formal fatwa. It's not a ruling, ask your local imam.
It's just based on our knowledge and expertise of our respective fields.
Exactly. All right, so let's talk about our first topic.
Right.
The first topic today is physician-assisted suicide, because today New Jersey passed the medical aid in dying for the terminally ill law, which means today, as a result, if you live in New Jersey and you have a terminal illness, you can request a prescription to end your life.
Right, and you specifically mentioned that it has to be projected that you only have 6 months to live.
Right. So the way the law currently sets up is you have to have a diagnosis of an incurable, irreversible, confirmed disease that you'll die in 6 months or less.
Right.
And it can't be just because of age or disability. If I tell you you're too old and you're going to die, that's not the same diagnosis.
Right.
Or if you have a disability, you can't walk ever again, that's not a terminal illness. So the idea is New Jersey passed a couple requirements here. You have to have this diagnosis. You have to have 2 doctors sign off that you had the diagnosis. And that you have to the patient has to ask for it twice within 2 weeks apart, and submit a plan in writing that, yes, I know the risks. I know that I've been informed. I know I want to die. And then you can also get a mental health professional to come in and consult and see them as well. And so I've got 5 states right now already have these laws. It's called death with dignity laws. Oregon was the first one. They said you have a right to prescribe a lethal amount of drugs to die. California, Colorado, Hawaii, Oregon, Vermont, they all have this on the books where if you are dying, or if you are terminal illness and you are dying, you can ask to speed it up, basically.
Now, the prescription, which entails the DWD, death with dignity, I'm just asking because I'm wondering whether this is the same type of like combo medication that's used for conventional prison lethal injections. Is it like the same?
That's a really good question because a lot of people do have that kind of worry. Can you just tilt the microphone a little bit, turn it away from me a little?
Yeah.
That way, because too much echo here.
Right.
That's a really good question because people do ask, is this the same as lethal injection? Not really. That one is, now the idea is it's the goal is the same. They want you to die.
The result is the same.
The result is the same.
Right.
So the way this works is they usually give you 1 or 2 medications. One of them is like a really powerful painkiller, so you just fall asleep. And the other one's something that's going to slow you, stop your breathing, or stop your heart.
Right.
So the ones in prisons tend to be injections, and they can be kind of painful. The one that people get in death with dignity healthcare settings tends to be, well, it's not even in a healthcare setting. I want to be very clear about that part because people think that you're dying in a hospital. This is usually people who are home, what they call hospice.
Right.
So hospice is the idea is that if you are incurably dying, we want to withdraw treatment or just keep you comfortable. You're not in the hospital. You're home. You're with loved ones, and they can do it from a hospice scenario. This is some medication that just makes you fall asleep and stops your breathing.
Right.
So the idea is you could die in your own bed.
Right. So even in terms of hospice, because in our modern healthcare setting, we do have facilities that are literally labeled or titled hospice care centers. Right. So would that also fall under that, or would it exclusively be someone dying at home?
It can be an either. Now the way this is a super controversial topic because a lot of doctors
for obvious reasons.
Hospices are very against this. Hospitals are against it. Doctors are against it. So if a patient wants to do it, the hospice can say we're part of this, or could say no, we're not doing it here. Go somewhere else. So that brings up the next point because it's super controversial. Who would be responsible medically and secularly, legally to administer this death with dignity medication? Who is medically and legally responsible to do that, to perform that? That's a good question because I don't want to do it. The idea is that the patient can go home and take their own pills, or if you have like a nurse or family member who can help you take the medication. People assume this is like lethal injection, like you said, like in prisons, and doctors are like, no, we're not even touching this. This is more like giving you a prescription. You can go home and get it filled. Now, people, if you have incurable diseases, you're taking morphine, you're taking other medications. This is basically a much, much higher dose, like a deadly dose. So for lack of a better term, this is basically suicide medication? Yes. For lack of a better term. Okay. Yeah. So, I mean, that's basically what it is. If you take too much painkillers, your breathing will stop, you go into a coma. They're basically giving you a super high amount that's going to do it. So it's like some propofol type stuff. It's like propofol type stuff, yeah. Now, it's not as guaranteed to work because lethal injections, like you talk about, you're in a prison setting. That's when they give you an injection of potassium, your heart just stops. Right. This is more like you go into a coma, your breathing slows down, then you just stop breathing. So the idea is you could take a couple of hours to die with this. It's normal to take like 2 or 3 hours and your breathing starts and stops, but you're not awake for this. That's the idea. So the idea is that you go to sleep, you're never going to wake up again. Yeah, pretty crazy, huh? That's it. That is pretty crazy. Yeah. Also, it's one of the things that you mentioned concerning who signs off on the declaration for a person to request DWD. In the notes that you gave us, you mentioned that one of the people who are witnesses cannot be a family member who's like a beneficiary of a life insurance policy or a medical professional that is to gain from the person's demise. So elaborate on that, how that works. So this was a big, they want to make sure this is voluntary because let's face it, ever since the Nazis executed a lot of people, there's a lot of laws on the books about what you can and can't give. Right. So this has to be, you need 2 people to witness that this is a voluntary decision by the patient. Right. And one of them cannot be a person who can gain from the benefits, meaning they can't be in the will, they can't be anything like that. They can't be. So basically, no known family members. Well, at least one of them has to be not a family member. Okay. That way, there's no conflict of interest. And at the same time, it's got to be. It should not want. At least one of them has to not be the doctor or the nurse or the nursing home employee because they don't want. The idea is that the doctors just to be killing people left and right without the family. Like some Kevorkian type stuff. They're very afraid of Kevorkian. So, people are young enough to not realize. Is he still alive, by the way? I think he just recently died. Okay. So, to people who don't understand, Dr. Kevorkian was a very famous doctor in the 90s who said that we should have a right to for terminal patients to commit medical suicide.
Right.
And he would assist people.
So basically, he was a forerunner of what's being secularly legalized now.
Yeah, he was very big on this. He said this is just cruel to keep people alive for no reason. If people want to end their lives with dignity, we should be able to do that. He would prescribe large amounts of medication to kill you, basically poison. And he went to jail at least more than once for this. And he said this is, he basically, he said, I'm going to become a martyr for this cause. I think it should be ethical that you should be able to kill yourself. If you're a terminal case. And they charge him with manslaughter because he was assisting in suicides. Suicide is still illegal, and assisting in suicide is a misdemeanor or a felony.
Right.
So they're charging him with...
Because easily you can be charged with murder.
Yeah.
Or premeditated murder. Because in a case like this, you know for a fact that the person wants to die, or they say they want to die. So for you to assist in that from an issue of legality, you would be an active participant in premeditated murder. Basically.
Absolutely, they were charged with manslaughter.
Yeah, it's like someone saying, "Oh, I want to kill myself," and you give them a loaded gun.
Yeah, exactly.
Basically, yeah.
That's basically it. Yeah.
Right.
So, so it's basically they tried putting these restrictions in there to say it's got to be, you really have to, this isn't like a spur of the moment. This isn't like I just thought about it right now, I want to do it. You actually have to, there's that 15-day waiting period.
Right.
And you have to sign documents. I know what this means. I know this means it's not reversible. I know this is what I want to do. I'm not thinking about anything else, because the big worry is not just is someone going to pressure you, is the family going to pressure you?
Right, because you have some people who are dark-hearted, who is like, yo, let's get this person the hell out of here so we get this money type of thing. Like,
absolutely,
that sets a very negative precedent. Yeah.
Oh yeah.
Yeah.
Big precedent. And that's the fear. So so they put a lot of restrictions on it. You can't be disabled. You can't be just because of old age. Right. You have to have multiple people signing off on this. You have to be sound mind. If you're having suicidal thoughts and you're just depressed, they're not supposed to do that.
Right. Because those aren't valid grounds.
Right.
Because you have no idea where the person's psycho-emotional constitution is.
Right. So I think we have a pretty good idea of what this involves, because I said other states have done this, and so far in America, about 4,000 people have done this in the last 15 years.
Wow.
And it went to the Supreme Court, actually. Is this something that's legal? Because the federal government doesn't allow this, but the state governments were doing it.
Right.
And the Supreme Court said, no, the states have the right to pick this.
Ouch.
Yeah. It's, as I said before, it's super controversial. It's legal, but doctors are not there yet.
Right. Because like you said, one of the key things is that just from a medical perspective, it completely is antithetical to the principles of the Hippocratic Oath.
Right. So, exactly. It's not appropriate for doctors to do anything that speeds up death. That's like the opposite of what we want to do.
Right.
So, and this has been brought up over and over again. The American Medical Association has said, look, it's just not compatible with being a doctor. It's just, you're a healer. You can't, it's opposite of being a healer. You can't control it if you open the door for this.
There's no going back.
Yeah. What are the risks to society if you start doing this?
Exactly. Yeah. So just for clarity, what's the biomedical definition of suicide? Or is there a biomedical definition of suicide?
So that's a really good question. Because people don't want to call it suicide. The people who support this law, they don't want to call it suicide.
Right.
It's a bad title. They don't like that. They want to call it...
So to them, it's like the S word.
Oh, yeah. They call it assisted dying.
Right.
They'd rather that. Because people, to be fair, I think it's understandable that from a certain point, like, look, if I told you you're going to die, and you're going to die in less than 6 months, you're not going to make it till Christmas, and it's going to hurt. People do not want to hear that.
Right.
There are people who leave the hospital and go and jump off the bridge.
Yeah. But at the same time, this, like you said, and we're going to get into the Islamic perspective of this, is that this sets a very ugly precedent of what we know in the medical field, the healthcare field, of the playing God pathology.
Oh, yeah.
Because Allah is Al-Alim. Allah is the all-knowing. Mm-hmm. Only Allah knows when someone's going to get their ticket punched and when someone's going to be preserved.
Right.
So just on that basis alone, we don't have a entitlement or justification to say, we know for a fact you're going to die in 6 months from a terminal disease.
Yeah.
because it's been medically proven that people have gotten death diagnosis and they've survived.
Oh, yes.
This is historically and medically proven.
Very true.
You know what I'm saying?
Oh, yeah. So the way it works is I have patients who are on hospice. And to be on hospice, I have to certify that, yes, you have 6 months left to or less to live.
Right.
There are people who live for 9, 10, 12 months. And so I have to go and say, well, I know we said that before, but we give them an extra 2 or 3 months, extra 3 months, extra 3 months. If they live for more than a year, we kind of have to take the hospice off.
Literally. Yeah.
Yeah. And because it's you, and they, I was like, am I getting in trouble for that? They said, no, because you never know.
And that's the point.
That's the point.
And that's when the whole playing God pathology comes into play, because we don't have the knowledge that Allah has. That's
Right.
from the ghaib, that's from the unseen.
Exactly.
And only Allah knows when exactly someone's going to stop living and dying.
Right.
You know what I'm saying? So that's why that's why I asked you, what is the biomedical definition of suicide, if there is one?
Right. That's a good point that you brought up, because, so yeah, suicide is anything that kills yourself. Euthanasia is another word we use when you're killing someone else. Now, this is where it gets sort of iffy, because we don't have a really good definition of what's the cutoff here. Because there's active euthanasia, I'm giving you something that kills you. And there's passive euthanasia, which means like, you're dying, I'm going to pull the plug, or I'm going to not give you the surgery, or I'm not going to do CPR. And does that count as euthanasia? Does that count as killing you?
Right. And also that even comes into pertaining to the medical directives.
Right.
Because you have some people, they'll take the position that certain medical directives are a form of euthanasia.
Yes.
Like a person, like let's say for example, DNR, do not resuscitate, or DNI, do not intubate.
Right.
Or the other one, which is more neutral, which ironically is more in line with Al-Islam anyway, is A&D, allow natural death.
Yes, yes. So I think the short answer is everyone wants to take medical ethics in medical school. It's a requirement, because it's very obvious these are not easy answers.
Right.
There's no flat yes or no, black and white answer to these.
There's lots of gray area.
There's a lot of gray area.
Now in medical school, you can attest to this, they teach a lot of black and white.
Well, they
From
start
a textbook perspective, but in the real field, you find out that there's more gray and less black and white.
Oh yeah, exactly. I think they try to get you ahead of that by doing, one of the first classes you take in medical school is bioethics, because they realize there's not easy answers to this. Do you have a right to die? Do you have a right to refuse treatment? So there's, it's fine. Islam has schools of thought.
Right.
And different
legal schools, the
philosophies.
different, I have the different legal schools.
Exactly. And medicine has its own.
Right.
So just to give you a quickie idea, because medicine has different schools of thought also.
Right.
There's one called paternalism. It's like, I'm the doctor, I know best, the same way a minor can't refuse.
Okay. Right.
Because there are people, if someone comes in and saying, let me die, I don't want you to touch me, but they're dying.
Right.
Is that something, do you have to listen to them? No, if they're delirious or they're high or they're drunk or something, I can't say, he said don't treat him. I have to treat him.
Right. Right.
They'll thank me later.
Right.
And
right.
And people are vulnerable. You got to protect the vulnerable.
Right.
So that's paternalist idea. And there's also a very famous philosopher called Kant. He called deontology. It's like, if something is wrong, it's always wrong. There's no excuses.
Okay.
So
in other words, like circumstances or like modernity don't make it right. If it's wrong, it's set in stone wrong.
Yeah. If it's a sin to lie, it doesn't matter what you're lying about.
Right.
It will never, ever be okay.
Okay.
Even if you save a life by lying, you're still kind of breaking the rules there. They're going to say it's never moral to lie for that. So the idea is if suicide is always wrong, then there's no excuse. I shouldn't think about whether they're in pain or not. Suicide is wrong. Whether or not they're going to hurt for a month, that's not my problem, because the ends don't justify the means.
Right. Right.
And then lastly, there's a thing called utilitarianism, which is what's the greatest good for everybody. So, hospice patients, they're in pain. And now they're causing the family to suffer. Now the whole family's suffering because this patient's staying alive.
Right.
And now the healthcare system is being strained, not enough beds. And so we
know what
kind
that's
of,
about, right?
Oh,
yeah.
Money.
Yeah.
Oh, yeah. Half of all healthcare costs in the U.S. are in the last 6 months of life.
Yeah.
So there's a reason they say we should encourage
those are
this.
the most expensive healthcare costs.
Oh, yeah. So not just because is it the right thing to do, but also to save
About
money.
dollars and cents.
Dollars and cents. So advanced directives, it's not just because I can't make a decision. I want the family's going to know what to go through. At the same time, I'm like, hey, let's get this over with faster.
Right.
So there is a little bit of a component of that too.
Yeah.
So those are different schools of thoughts in medicine. And the answer is there's no right answer. It kind of depends on, it's a judgment call. It's not just my judgment, it's the patient's judgment.
And that's why we have ethics committees.
That's why we have ethics committees, because you're always going to find a case where there's some DNR, do not resuscitate orders, like you said, allow natural death. There's going to be patients who want it. I don't want CPR. I don't want blood. I don't want oxygen. I don't want life support machines. No CPR, nothing. And the family's like, no, I want you to do it. Well, who you listen to?
There was actually an ethics committee that I sat on during my chaplaincy residency, and there was a person who they did not want DNR, DNI, any of that. Wow. But their power of attorney stepped up and then wanted the person to be revived. And the person was like in a comatose state. The person was like in a vegetative state.
Yeah.
But because the doctor remembered the patient while they were conscious, he brought the point up that this person specifically detailed word for word that they did not want to be resuscitated or intubated or anything. And legally they were obligated to respect the wishes of that patient because of what the doctor had said, in spite of the power of attorney contesting it.
Yeah.
So things like that happen all the time.
Definitely. So is there any Islamic position on end of life, suicide, euthanasia?
Right. Now, just as a point of reference, all of our podcast episodes are going to be based on what's known as Maqasid al-Sharia, which is the objectives of Islamic law.
Yeah.
Now, the two main objectives that we're going to be focusing on for every podcast is pertaining to the preservation of morality, integrity, and the preservation of life, well-being, welfare. Now, in terms of the preservation of morality, integrity, this pertains to ensuring the morals. It pertains to ensuring that moral standards are maintained within human society, such as chastity, ethics, character, honesty, kindness, philanthropy, and to avoid, abolish all of the opposites of the aforementioned. Now, in terms of integrity and dignity of a human being in a healthcare setting, being a recipient of healthcare, we have to make sure that whatever decision is made is in the best interest of the morality and the dignity of that patient, regardless whether it results in the preservation of their life or whether it contributes to their demise.
I see.
And then the second thing in general is pertaining to the preservation of life, well-being, welfare, which entails maintaining the sacredness of life, health, etc., and educating people on how to care for themselves as well as others via respect for human life, health, etc.
I see.
Now, this pertains to the fact that the default objective is to preserve life at all costs, if or whenever humanly necessary.
Right.
Now, sometimes the preservation of integrity and the preservation of life intersect and they overlap.
Yeah.
But then there's other times where they become mutually exclusive. There's at some times where preserving a person's life is actually harmful to their dignity. It's actually harmful because they're, like you said, they're suffering, right?
Yeah.
But in terms of the Islamic definition of suicide, the Islamic definition of suicide is something that's very rigid. The Islamic definition of suicide is literally to do anything that causes your life to end acutely. So in other words, if I put a gun in my mouth, may Allah forbid, pull the trigger, I die. That's suicide. If I slit my wrist and I die, that's suicide. Those are suicidal acts, right? So typically, Islamically, anything that you do to yourself, which is the immediate result and cause of your death, that is suicide.
Yeah.
Now, in terms of an assistant suicide or euthanasia, classically that cannot be considered suicide because it's not the person personally doing it to themselves, unless in the case that you mentioned, they're actually taking medication themselves.
Yeah.
That would be Islamically considered suicide. But if someone approves for someone to do that to them, Islamically, that's not suicide. It's something morally incorrect. It's something which would be classified as mahrum or Islamically prohibited.
Gotcha.
But it wouldn't be suicide because suicide directly entails that you're literally doing it to yourself personally.
Oh, okay.
Right.
That makes a lot of sense.
Yeah. Now, again, the reason why this becomes problematic still is because Allah makes it very clear in the Quran, chapter 2, verse 195. Allah says, "And do not lead yourself to destruction via your own hands."
Right.
What that means is that Islamically, principally, we're not allowed to do anything to ourselves which causes us harm or which causes us unnecessary death.
Okay.
Right, and that includes anything. That includes drug usage, lifestyle, or anything that contributes to our own primal demise.
I see.
You know what I'm saying?
Yeah. Okay. So one question, I had a real case. There was this old man, he was a Muslim guy.
Right.
He had cancer, and he really did not want to do chemo. And we told him, if you don't have chemo, you're going to die.
Right.
If he refused chemo, because to be fair, chemotherapy, it's not fun. You lose your hair, you feel weak, you feel sick, you feel like you're in pain.
Ironically, some people die from the chemo before the actual disease.
Sure.
Ironically, yeah.
So if you refuse chemo, is that the same as suicide?
No.
No.
Because he's not literally inflicting something upon himself.
Not by his own hands.
Not by his own hand. Now, what he is doing is that he's refusing treatment.
Yeah.
But that still falls under the general principle Islamically as do not be led to destruction by your own hands, meaning also your own decisions. Because when Allah mentions hands in the Quran pertaining to human beings, he's not always literally referring to what we do with our hands. He's also pertaining to our speech, just our general decision making. So when Allah says, and do not be led to destruction by your own hands, he's literally saying, do not let your decision making destroy you in any way.
I see.
Whether the destruction is spiritual, whether the destruction is psycho-emotional, whether the destruction is primal. Allah is giving us a clear warning, do not let our decision making lead us to destruction.
Right. Okay.
So that would be a decision that would be a decision that would literally lead to a person's primal demise.
Sure.
That, in all fairness, in all honesty, those types of decisions, it's like you're damned if you do, you're damned if you don't.
Yeah.
You're literally kind of stuck between a rock and a hard place type of thing. And you know as well as I do, I tell people this all the time, there's no such thing as an easy decision. There's only necessary decisions.
Right.
You know what I'm saying?
Sure.
But there's a narration that's really interesting pertaining to wishing for death. And there's many narrations that speak about the prohibition of wishing for death or wanting to die. Anas ibn Malik, may Allah be pleased with him, stated that Muhammad, peace be upon him, said, no one of you should wish for death because of hardship, harm that has befallen him. Rather, if he must do that, then let him say, O Allah, keep me alive so long as life is good for me, and cause me to die if/when death is good for me. So this is pertaining to, if anything, Muhammad, peace be upon him, warned us, do not wish for death. But if anything, rather say, ask Allah, if it is better for me to live, then let me continue living. But if it's better for me to die, then take my life.
I see.
Right. But that still doesn't mean that we actually make a decision to put a gun in our mouth, pull a trigger. Doesn't mean that we deny medical treatment that could either potentially save our lives or preserve our lives or prolong our lives, or at least make the pain less overbearing. You know what I'm saying?
Yeah. There's some Muslims I have run into who claim that's a more of a gray area than you and I are saying. Like,
I agree with that completely.
Right. Well, sure, but like this is what's such a difficult topic because there's not a really good cutoff. For example, okay, it would be haram to take poison and kill yourself, right?
Right.
But would it be haram to start smoking? See,
that would be just as haram because it's a type of poison. It's not something that kills you acutely.
Right.
Like, for example, I'm glad you mentioned that. Any substance that causes harm to the body, in principle, is mahrum. Right. And it's something, depending on the severity of the substance, the damage of the substance, it can kill you slowly. But let's say, for example, if a person is a cigarette smoker, right? Can we say that person is suicidal Islamically? No.
Right.
In spite of the fact that the person may die from cigarette smoking, can we say that that person was suicidal? No.
Yeah.
We can't say that. It's true that that action led to their death, but we can't say that that person committed suicide.
Right.
Just like if a person dies from a drug overdose.
Right.
It's completely Islamically unjust and unfair to assume that a person was suicidal if they die from a drug overdose.
Right.
Because typically, people aren't necessarily trying to die. They're trying to get high. It just means that, as Allah would have it, they end up dying.
Sure.
You know what I'm saying? So even those type of things.
I see. That's a good point. So yeah, it's just there's so many slippery slopes here, you know.
Yeah. Particularly with this particular subject.
With this subject, oh, definitely. This is one of the first things because no one can really like give you a good definition of where's the cutoff, where does it end,
Right.
You know. Now there are people who like patients say, I want to pull the plug on my grandmother.
Right.
Can I do that? I don't know. It's something that I'd have to see the ethics committee, talk to other people.
Right.
There's no great
because at the end of the day, the decision you make, not only does it affect the lives of other people, it directly affects your position with Allah.
Right.
Now, what if you pull the plug on someone, and how do we know that we were even Islamically justified to do that at that point?
Yeah.
Because realistically, we don't. It's just something we're going to have to meet Allah with, and He will judge us.
Yeah.
Based on that, but it's like. Are you brave enough or foolish enough to just be like, all right, whatever happens on the day of standing is just going to have to happen? Are you brave enough or foolish enough to take that posture?
Right.
Or are you going to be more reserved and be like, you know what? This is not something I'm willing to gamble with my soul with,
Sure.
that type of thing, you know?
Definitely. So this comes another point because there's a bit of a slippery slope.
But then you have
here.
doctors who don't care. You even have some Muslim doctors who don't care. From their perspective, their posture is, it's my job, based on just the raw facts. It is what it is, and then they pull the plug. That type of thing, you know.
Sure. And then it becomes so they tried to put really good limits in this because they're worried about slippery slope. You know, if it's okay for a terminal cancer patient to get assisted suicide, what about an AIDS patient?
The same principle applies then, right? Because basically anything that's terminal, anything that's classified as terminal. But then again, you have people who are HIV positive. They end up living, what, damn near 30, 40 years.
Definitely.
You know what I'm saying?
Sure.
So it's really, but like you said, AIDS is a whole different, different animal. Yeah.
Sure. But it comes up because this is something that's been brought up in bioethics.
Definitely.
Or you have a patient comes in and they have an infection of flesh-eating bacteria in their leg. You have to amputate your leg.
Right.
And I don't want you to. I'd rather die than not be able to walk. Well, then what do?
That's a good question. Yeah. But and that also fall under that prohibition of seeking or wanting death, and just going back to what Allah says in chapter 2 verse 195, and do not be led to destruction by your own hands. That's a good example. If you're getting medical advice stating that if you don't cut your limb off, you're gonna die, and you make the decision, I'd rather die than lose my limb.
Sure.
You're literally being led to destruction by your own hands, by your own decision making, right?
Definitely.
And then also what Allah says this twice. Allah says this in chapter 6, verse 151, and also in chapter 17. Allah says, and do not kill someone whom Allah has sanctified without justification. So just as a basic principle, you don't have a right to even take your own life.
I see.
Because Allah has imposed sanctity upon our lives. And there's no revelation, not even prior to the revelation of the Quran, which gives a license for a person to take their own life.
I see what you mean.
You know what I'm saying? So it's about that.
Okay. Another question comes up. Let's see we're in New Jersey, and a patient says to me, I want to commit assisted suicide, and I refuse. Now, under the law, I can say, no, that's not for me. I'm not doing that. But is it if they say, well, find me someone who can? Now, if I say, well,
you mean if they press you to give them a referral?
Yeah.
Oh wow, that's something.
That is something. Like this is a tough one because I don't want to have any responsibility. I want to wash my hands of this completely.
You don't want any part of it.
I don't want any part of that.
Right.
If I view this as something haram,
why would you give them a referral to another doctor? Right.
Yeah, because then I'm taking part in it anyway,
right.
And then I get a copy of all the bad deeds.
Right.
This is a very similar thing for, let's say, abortion.
Well, let's save the abortion thing.
Abortion's
for another
episode.
time. That's another episode.
But yeah, it is.
That's
a tough
an episode
one.
by itself.
Absolutely.
Yeah.
So, this is a good question. Look, does Islam lean into one of these, or is it kind of a mix? Because you're right, it's not a very clear-cut argument. I think Islam does give you some general principles.
Right.
You can't actively, by your own actions, commit suicide.
Right.
If you want to refuse treatment and die sooner or later, you can.
Yeah.
It's a different sort
and
of
your
argument.
judgment is with Allah pertaining to that. Allah will judge you accordingly. Right.
Sure.
But to actually rely upon someone to clinically administer death to you,
yeah,
that's a whole nother can of worms. relatives.
Oh yeah.
That's a whole nother can of worms.
And they'll make it tough because there's no, like I said, there's always some strange example or some example of, I can't walk, I'm in a wheelchair, I need my family to take care of me, I'm running out of the family, I'm spending all the family's money on my health care, can I just, die early?
Right.
And people ask this.
Yeah.
And there are people who are like, I have at home this big bottle of pills, I could take them all and die right away, but at the same time, I don't want to die because my family will be upset.
Right.
And people will live with pain.
Yeah.
To live longer just because they don't want to hurt their relatives.
Yeah. But also you'll have someone like who is it that died recently? Was it Stephen Hawking, who's in a wheelchair?
Yeah.
He was in a wheelchair what 20, 30 years, something
More.
like that? Yeah.
Long time.
You know what I'm saying? What disease did he suffer from which caused him to become like paraplegic?
He had something called ALS, which is amyotrophic lateral sclerosis. You just go weaker and weaker until you can feel, but you have no motor. So you just go weak and weak and weak. He was basically from the neck down, and he couldn't even speak anymore because his voice got too weak.
Right. So someone like him, someone could have easily been like, oh, well, he has a justification to take his own life.
Yeah.
But he didn't.
Yeah.
For whatever his reasons were, he just didn't.
Sure.
You know what I'm saying? So even that alone is a proof against what others are like pontificating, promoting.
Oh, yeah. Yeah, and this comes up because
outside of revelation, just from a universal human perspective, if anyone had a right to declare self-euthanization, it would be him. Just from a human perspective.
Sure.
We're not just about revelation, from a secular perspective. But he didn't choose to do that.
Sure.
You know what I'm saying?
Absolutely. And people do bring up secular reasons. Someone got shot and they can't, and they're numb from the neck down, and they're in a wheelchair for life.
Right.
There are people who are like, I don't want to go through with that.
Right.
And then people who would rather they want to commit suicide. And people have gone all the way to Oregon to commit suicide.
As a matter of fact, we had taken some bioethics when I was doing my chaplaincy residency, and they asked us to, well, they didn't really ask us, it was actually an assignment, it was like mandatory. So we had to do assignments pertaining to what were our bare minimums that we were allowed to live with or not allowed to live with.
I see.
So I had chosen for myself,
Yeah.
if I'm not able to like think and speak on my own, then I don't want to live anymore.
I see.
That was just like me personally. So you have other people who say, oh, well, my bare minimum is being able to walk.
Yeah.
Or my bare minimum is being able to see, or this or that.
Everyone's got some sort of limit at some point.
Right.
And
now, that doesn't make it Islamically correct or incorrect. It's just what it is, how you feel, what you think in that moment in time.
Right.
You know, but like you said, some people just have those like bare minimum type of things. You know what I'm saying? On the live, do anyone have any like questions or?
So if anyone has any questions, we're live going right now. You could always send one in, and I can try answering while we're here.
Yeah, definitely. Yeah.
So people coming in and out.
Yeah, I mean that's good. That's good. I mean it's the first episode, so yeah.
Sure. Well, now our Facebook page is pretty new, so we're still getting people coming in.
But the good thing is that we've tagged our own pages so that people that are our friends on Facebook, they can see it. They can come on their news feed and like kind of get like the maximum viewership. So
Definitely.
That's not the point. Yeah.
So this is always a worry. Like, there are cases where there was a very famous case about a good 10 years ago, the Terry Schiavo case, where this woman she had a stroke and she was in a bit of a coma, brain damaged. She was basically brain dead, but they weren't 100% sure if she was brain dead or not. And the husband wanted to pull the plug. He says, let's just withdraw her feeding and let her pass. The in-laws, her parents, said, no, you're not. You're keeping her alive.
Right.
And it became a real fight in the courts because the parents were accusing the husband
of just wanting her to kick the bucket so he can collect insurance or whatever.
And that was it. And he said, no, she told me she doesn't want to be on life support. Now, no one witnessed it, so who knows? And it was a real fight where the judge was like, well, who do I side with? The husband or the parents? And it became a very big story.
And even Islamically, that would have to be taken into consideration as well, because Islamically, who has more rights? The husband or the parents?
Exactly.
Now, in certain circumstances, the husband definitely has more right over the wife than the parents, but in certain circumstances also, the parents have more rights than the husband. So that's like literally like that classic tug of war type of thing.
Legally, the same thing happens. I believe the husband has a certain say, but then it becomes an issue of, I think it's the husband has the first say in the matter, and then the living children, adult children, and then the parents, I believe, and then beyond that, it goes to more extended relatives.
Right.
But if it gets that hard, I would call every hospital has an ethics committee for really difficult cases like this, and they meet and they try talking to the family and try reconciling things, because if you can get all on the same page, then that's not a problem.
Unfortunately, many, I'm not going to say most, but many times there's never the same page.
Very true.
Many times. Not most times, but many times. And, I mean, obviously, we know Islamically the reverse is also true as well. It's like you have to decide, okay, who has more right? Does a wife have more right over her husband, or do the man's parent have more right over him? Especially in these type of cases. You know what I'm saying? So it's very relative, because even Islamically, the same thing pertaining to the rights that the husband has over the wife. Also, there's rights that the wife have over the husband. You know what I'm saying? Just like there's rights that parents have over a man, their son. Yeah. In turn, also, there's rights that parents would have over a woman, their daughter.
Sure.
It's like you said, especially in terms of like bioethics issues, those rights Islamically would have to be considered as well.
Definitely.
So it's very like white knuckle.
It is. It is.
It's not easy.
I got to tell you, a lot of doctors hate these sorts of challenges because it's not a simple answer. If you told me, well, they have this sort of disease, I can treat that. It's not something you can find in a textbook that easily.
Right.
And then it also
and even if it's textbook, human circumstances are the real predicate for how these things play out.
Right.
You know what I'm saying? So you can have textbook all you want, but if the human circumstance opposes the textbook, then what do?
Right.
You're forced to operate outside of that textbook comfort zone, and a lot of professionals are not able to do that. Chaplains included.
Yeah.
Yeah.
You're right. If you go ask a bunch of doctors in the hospital, you're not going to get a consensus. Everyone's a little different on this issue. Because the Hippocratic Oath, the original one people took says, I will not ever give someone an overdose of drugs to commit suicide. And there also other things, I would never commit an abortion, I would never do other things. But this idea has lingered around. However, a lot of doctors are coming around to this.
What was the Hippocratic Oath when Socrates took hemlock poison?
See, he wasn't a doctor then. So he just got it from some herbalist, He drank the hemlock.
Oh my God.
Yes.
So yeah, those things are very crucial in terms of our, first of all, as being Muslim first in our practice of Islam, and then as healthcare practitioners, healthcare providers, even though respectively you and I, we provide healthcare in different veins, but the goal is the same. You know what I'm saying? The maslaha, the purpose is the same, is to provide dignity through our service. You know what I'm saying? So we have to find out what's the most dignified modality, which, number one, coincides with al-Islam, and then two, coincides with our mandated medically ethical standards.
Sure. Most definitely. And I was saying before, doctors are changing on this. It used to be all the medical associations said, no, it's illegal, it's against it, we're absolutely opposed to it. Now, recently, the American Association of Family Physicians, which is what I'm a part of, they just recently switched from being against it to now they're neutral. They said, if you're in California or New Jersey, it's kind of up to you. We're not gonna say either way. There was enough people who argued about it that they said, okay, we're just going to take our name off of it.
Realistically, do you think something like this would ever be approved in New York State?
Ooh, that's a tough one. I think New York would come around to it, because all you have to do is have enough people to go to politicians and say,
and make noise about it.
My sick mother, are you going to force me to take care of her for another 3 years? She wants to die, or she doesn't even know where she is right now. It's going to be a tough one, because at the same time, no one wants to. I don't want to put in that situation. I don't want anyone to be in that situation where, especially, do you want your kids to say we have the right to euthanize you?
Right, exactly. And then also, as well as I do, that the United States really sucks at caring for geriatric persons anyway, or people who are.
It's bad.
It's really, really bad, right? Especially pertaining to like terminally ill. Our nation is probably like among the top 10 worst nations to live in if you're terminally ill or if you're geriatric.
Oh yeah.
Because you just get like abused every way till Sunday.
It's a tough situation.
Really
I talk to
tough
doctors
situation.
other countries.
So it makes sense why in the United States people are becoming more gun-ho about, oh yeah, if they want to die, just put them out of their misery type of thing.
It's very different because in other countries, they just don't have nursing homes. If someone's sick and elderly, they're living with the family.
Literally.
You have a nurse come and visit the family.
But not in a nursing home.
But not in a nursing home. They almost never exist.
I've literally visited people when I was doing my chaplaincy residency, when I was doing my rounds at nursing homes, and they've literally said that they haven't received a visit from a loved one in 10 years. And they've been in the nursing home for 10 years. You have some people, they've literally said, I feel like I'm in prison.
That's just sad.
Like me personally,
Yeah.
I was homeless my entire senior year of high school.
Wow.
And then beyond, even after I graduated. I was homeless from 1999 to 2001. We had an electrical fire in my apartment.
Yeah.
I would literally rather have that experience again as opposed to being in a nursing home where I'm literally dependent on medical care, health care, because you have some people, they just don't care. And they would have no problem euthanizing you just to get you out of the way.
Oh, yeah.
You know what I'm saying? And it's really sad that we live in a nation, we live in a society that is literally not even thinking about the spiritual ramifications or consequences of these actions. They're just doing it because, like you said, oh, we need an empty bed for another client, for another customer. That type of thing.
You're right. I think our society has a problem where they just want these people to go away. Not necessarily kill them, but like wherever the trash goes when you're done with it, it's just out of your sight.
Yeah.
So somewhere.
Yeah.
You're right. There are places, other countries that do have nursing homes. Those are people who have like or orphans and things, or have no living relatives left.
Right. Yeah. But if you have living relatives, there's like basically no justification Islamically for you to be in a nursing home and you have family. Right. There's no moral, ethical justification for that.
And nursing homes, they're also very expensive. People go bankrupt.
Yeah.
Because nursing homes are almost like hospital prices. They're not cheap. And Medicare, which is senior citizens, doesn't cover it. So as a result...
They don't cover it at all?
They pay for 90 days and that's it. And so what happens is people who are elderly, they'll go into a nursing home and they're going to pay out of pocket until they run out of money. Their life savings go empty. And once you're empty, you go to Medicaid, and Medicaid will cover nursing homes. So the idea is you're basically forced to go broke for the first year, and then you're in Medicaid.
So basically all of your retirement, pension, 401k, all of that goes to the nursing home.
Yeah.
To house you.
There's almost no public nursing homes. There's almost none. There's a long wait list for them. So you're forced to go into a very expensive place, and your insurance, whatever insurance you have, is not going to cover it unless you're low income.
Honestly, I didn't know that most nursing homes were privatized.
Most of them are.
I really honestly didn't know that.
Yeah, I don't know if there's a lot in New York, but there's a wait list for them. So people, it's very common to see patients go broke in the nursing home. And then
that's a damn shame.
It is. And then, like, was the family going to pay for this? Well, no. Grandmother's going to have her own life savings. It's going to run out, and then this drains everything. Now, I'm sure there are proponents who are like, well, I don't want to be that. I don't want to be that drain on my family. Can I just commit medical suicide? As terrible as this is, I'm not sure if that's a justification.
But like you said, since this is becoming more secularly legal, people will start to use this as justification. I have a very negative feeling that people will try to impose this on their loved ones.
Oh, sure. There's people try imposing on loved ones all the time. They want to put their grandmother in a nursing home so they could sell the house and make money off of it.
Yeah. It's a known fact that some people who go to nursing homes, they end up dying because they're miserable there. They literally give up on life. Oh, yeah. They stop eating. It's horrible.
They're sad. And like you said, the reason they call this a Death with Dignity Act is because people are afraid. I don't want to be, incontinent, wearing a diaper, and I can't get out of bed, and I have to have someone wipe me down. It's humiliating.
Yeah.
So people think in advance, like, well, I can still talk to you, and I'm still don't have Alzheimer's right now. I want to make sure it never happens. We in the healthcare profession, we try to avoid this entire issue completely by doing advance directives. That's the whole idea. If we can talk you into getting this written down on paper, that we have a plan ahead in mind, we're not going to have fights with relatives, we're not going to have fights with family and property and everything. We can just make a clear plan, a living will, an advance directive, healthcare power of attorney, and just go from there.
Well, actually, what you mentioned about the medical directives, that's literally the clinical or medical equivalent to a wasiya, an Islamic will.
Really?
Yeah, because you're letting it be known up front how you want things to go.
Oh.
You know what I'm saying? So
okay.
It's literally like that. But like I said, when I mentioned earlier, is that for Muslims, the default directive, the medical directive that's most Islamically correct is A and D, allow natural death.
I see.
Right. And again, I mean, you're always going to have like ikhtilaf, you're always going to have scholastic differing pertaining to these medical directives themselves, you know.
Sure. Is there any, I'm very curious now, is there any sort of Islamic directives I could get from somebody? Like if I want to get myself a living will or something, or A&D directive right now, is there any Islamic sources I could go to look through to find out more?
Well, for what I know, the Janaza Project, which is headed by Nuruddin Rabah, shout out to the Janaza Project. They do great work in New York City in the tri-state area. They, from what I know, because I've done work with them, is that I know for a fact that their default medical directive for Muslim clients who make Islamic funerary preparations with them, I know for a fact that their medical directive is A&D. That's like the default. Allow natural death. That's like the default for them, because that's the medical directive that's most Islamically correct.
I see.
Now, depending on circumstances, you might have a situation where DNR is most Islamically correct.
Yeah.
Or DNI is most Islamically correct. But just overall, A&D is just by default the most Islamically correct medical directive. Just allow natural death.
I see. That's good to know.
Yeah. Because realistically, it doesn't matter which directive that you take or make. Allah is the one that is in charge of life or death anyway. Life or death are in his hands regardless. You know what I'm saying?
Yeah. So that's something I was always wondering, because I am worried I'm going to get a patient like this one day who's like, you know what, I'm dying of something, and I would like to talk to you about getting death with dignity, assisted suicide. Now, I would always say no personally, but the things I would do next would be I would probably have them see a psychologist to talk about it. Maybe there's some course of their stress, maybe what are their reasons, let's see if we can talk it over, and have them see a chaplain, right? Would you think that would be a good, I mean, you're a chaplain.
Right.
Would you be okay if I ever called you and said, hey, I have a patient who...
I've literally been called pertaining to things like this.
You have? Not
euthanasia, but in terms of medical directives and stuff like that.
Okay.
Yeah.
It makes a lot of sense.
I've been called in when I was working at hospitals. I've been called in to speak with patients pertaining to the medical directives that they wanted to decide, and or the medical directives that the patient's families wanted to decide. So I've literally been called in for those type of cases.
Wow.
Yeah.
Okay. Well, I was hoping to find any questions from the audience, but since it's the first episode, we're not getting a lot of people, fortunately.
Yeah.
But you know what? We will definitely
I think more than likely we'll have a lot of questions or comments in the comment section.
We're going to do a follow-up episode, I think, certain down the line, maybe the next episode at the beginning, or just have a Q&A episode.
Yeah.
We'll definitely do a recap at the next follow-up
definitely.
one.
Yeah, for sure.
Well, just want to say this is James Ferguson. This is
Gareth Bryant.
Okay, well, that does better for today's episode. We'll leave it there. If you have any questions or comments about today's episode, you can contact us by the Facebook page or tweet at us with questions and comments. My Twitter is at SulaymanF, SulaymanF, and Gareth's is...
My Twitter is the Muslim Model on Twitter as well as Instagram.
Okay.
Yeah.
Okay, so please help new listeners discover the show by leaving us a rating or review on iTunes. Tell someone about us. Like our Facebook page.
Share the page.
Share the page.
Shari is an enemy.
All right, well, thank you, and we'll see you soon.
Thank you.
All right.
All right.